Good morning and welcome to Access Health. Improving the patient's experience has been a continued priority for the healthcare community. Decreased trauma, alternative testing, and faster healing times are just a few ways the patient is safeguarded as a result of more options. Today, new treatment options for patients with thyroid cancer, non-invasive prenatal testing for expectant mothers, and a story that will have you saying bye-bye to surgical scars. I'm Erica Petrini. Access Health starts now. Welcome back. Radioactive iodine has been used successfully as a therapy for thyroid disease for more than 50 years. Today, a treatment option aimed at improving patient outcomes in thyroid cancer. Take a look.
The minute that I heard the word cancer, I immediately went to death sentence.
They found out that I had something weird in my neck. I got this bad news that I have cancer, and then I have to think about my life now.
To tell a patient that they have cancer is always very, very difficult. But it's also an opportunity to look at helping someone through what may be a very trying and stressful time for that patient.
The first thing that flashed through my mind was, I'm not going to see my son grow up.
The hardest part was stopping everything, stopping my life. I was involved in my school, and someone told you, no, it's over for now. You just have to press pause. Why?
The chance of being diagnosed with thyroid cancer has risen in recent years and is the most rapidly increasing cancer in the United States, with numbers almost tripling in the past 3 decades. Although surgery remains the current standard of care, statistics are showing that with the addition of radioactive iodine therapy, physicians can significantly improve outcomes. And joining us today is Dr. Douglas Van Nostrand, Director of Nuclear Medicine and Research at MedStar Washington Hospital Center. Doctor, thank you so much for joining us today.
My pleasure.
All right, so let's get right into it. Can you describe thyroid cancer for us?
There's really 4 types of thyroid cancers, and they're based upon the types of cells that are found within the thyroid. And there are what's called well-differentiated thyroid cancers, and that's papillary and follicular. And there's very rare cancers called medullary and anaplastic. The predominant ones that we experience are papillary and follicular cell thyroid cancers.
So doctor, how are we currently treating thyroid cancer?
There's 3 core components that are considered for the treatment of thyroid cancer, well-differentiated thyroid cancer. Surgical removal, a radioiodine therapy, and administration of thyroid hormone. Now, in regard to the surgery, the goal of the surgery is hopefully to cure that thyroid cancer by removing it completely. And then based upon the specific situation of each patient, radioiodine may be administered because there may be the possibility that thyroid cancer cells are left behind, and the radioiodine would then go to those thyroid cancer cells and kill those thyroid cancer cells, helping again to minimize the likelihood that there would be any recurrence later on and achieving a cure for that patient. Now, the interesting thing about radioiodine is that those thyroid cells and the thyroid cancer cells have a unique ability to want to take up that iodine because they need the iodine in order to make thyroid hormone. So we're taking advantage of that by having, if you will, a magic bullet that is radioactive that will then be specifically taken up by those thyroid cells, cancer cells, and then when they're in that particular cell, irradiate that cell and kill it.
Amazing. So doctor, how is radioactive iodine administered? Because I think I speak for a lot of us who they hear the word radiation or radioactive and they're concerned.
Well, the radioactive iodine is put inside of a capsule, and then the capsule is taken by the patient orally. It goes down through the stomach and the intestines, and then it's absorbed into the blood supply. But the beauty of this treatment is that the radioiodine that's not taken up by those thyroid cancer cells is relatively rapidly eliminated from the body, and it's eliminated through the urine, through the kidneys, and through the GI tract. Now, one concern that comes up that you raised earlier is about radiation and radioactivity. And when anybody talks about radiation or radioactivity, the first thing they say is, well, this is cancer. This is going to cause cancer. And it's a concern. But generally speaking, when one looks at the side effects of radioiodine from a first or second treatment, the increased risk of any type of other cancer is very, very low.
Doctor, what are the benefits of radioactive iodine, and are there any side effects?
There's really three potential benefits for the patient. The first, it can aid the physician who's going to follow this patient in order to look for recurrence of the thyroid cancer. The second is it reduces the likelihood of recurrence in patients. By receiving the radioiodine, one reduces recurrence rate. And the third is in patients who have had recurrence rate, it can extend life. Now, radioiodine, like any treatment, has side effects. The treatment of radioiodine, patients can have some nausea, and occasionally there is vomiting. One can get swelling and pain in their salivary glands. The salivary glands accumulate the iodine like the thyroid does. But with preventive medicines, one can help reduce the likelihood and the severity of that. And there's a lot of things that we can do with that. However, most people tolerate the radioiodine fairly well.
That sounds like it could be a great option for many people. Let's check in with our patients.
The reaction that I had to the radioactive iodine was very minimal, so there is no hair loss or anything like that. The side effects that I immediately felt, I was a little nauseous. One of the biggest fears that I faced after getting over the initial fear of having cancer was, will the radioactive iodine inhibit my ability to have another child? I was very blessed to have another son 5 years ago.
Having cancer for me, it brings me a totally different ways of approaching life because I'm more alive than ever.
That was so nice to see. So, doctor, what educational resources are available for families and patients?
Well, I'm really pleased that you asked that question because that's a very important issue for me. And there's many resources that are available. They include many patient books, many thyroid cancer support groups that are online, and a new one that I'm excited about is called TIME. And the TIME stands for thyroidectomy, surgery, iodine, the radioiodine therapy, monitoring, and expectations. And this is, I think, a really good program to help organize the patient to be their own advocate, but also to have a framework in order to work with a physician regarding what's the appropriate care for their particular thyroid cancer.
Doctor, thank you so much for coming here today. All this great information, helping keeping our viewers informed. Combination therapies and treatment, including radioactive iodine, are a powerful component in the battle against certain types of thyroid cancer. Ask your doctor if it may be right for you. For more information on radioactive iodine therapy, please visit draximage.com/TIME. And of course, you can always go to our website, accesshealth.tv. Don't forget to follow us on Facebook and Twitter. With today's technologies, new moms have a lot of options when it comes to getting early insight into their developing baby's genetic health. How do we know which prenatal screening options are right for us? Here with today's report is Amber Milk.
More than 4 million babies are born in this country each year, and a majority arrive healthy and full term. But that doesn't stop 78% of mothers-to-be from worrying about potential birth defects. Non-invasive prenatal testing, also referred to as NIPT, is a relatively new option in screening that can get you some of the insights you're looking for about your baby's health and reduce some of that anxiety. Here to help us navigate is Patty Tanasia. She's a genetic counselor from Illumina. Patty, thank you for being here.
Thank you for having me.
So Patty, I know so many women right now who are either pregnant or trying to get pregnant, and it seems like there's so much to worry about. Is this test for women who are over a certain age, or are there certain risk factors?
So information about the genetic health of your developing baby is important for moms at any age. Every woman who is pregnant has a chance or risk of having a baby with a certain type of chromosome condition like Down syndrome. The American College of Obstetricians and Gynecologists actually recommend that all pregnant women, regardless of age, be offered screening or testing during pregnancy for these common chromosome conditions. Screening has been around for a very long time. NIPT is the first prenatal screening option that actually looks at DNA from the developing pregnancy without needing to do an invasive procedure like an amniocentesis or chorionic villus sample, also known as CVS.
Okay, you mentioned NIPT is a screening test and not a diagnostic test. Can you explain the difference between the two?
Sure. So a screening test is one that will tell you if your pregnancy is at a higher chance for having one of the conditions screened for, but it doesn't give you a definite answer. A diagnostic test will give you a yes or no answer to whether that condition is present. However, in order to do these diagnostic tests, they're invasive procedures, and they do carry with them a small risk for miscarriage or pregnancy loss. Some women will start with a screening test and then use that information to decide if they'd like to pursue diagnostic testing later in pregnancy.
Okay, so what exactly is NIPT?
So NIPT is a very simple, non-invasive blood draw that's safe for both mom and baby. It can be done as early as 10 weeks in pregnancy, and often women have it in the first trimester. There are several different terms that are used for NIPT, so people might be familiar with other terminology like cell-free DNA testing, or non-invasive prenatal screening, or NIPS. When you do this blood draw, what you have is DNA that's circulating in mom's blood from the pregnancy. These little fragments of DNA can be analyzed to see if you have the correct or expected number of chromosomes present in that developing pregnancy. If the correct number of chromosomes is not present, so if an abnormality is determined, then this can have serious effects on the health and development of the baby.
So what exactly is NIPT screening for?
So NIPT looks for common chromosomal conditions that occur during pregnancy. These are ones that are not typically inherited, meaning there's not a family history, but they're more likely to happen by chance. So one that people are most familiar with is an extra copy of chromosome 21. This is also called trisomy 21 or Down syndrome. So NIPT screens for that, as well as trisomy 18 or Edwards syndrome, trisomy 13 or Petas syndrome, or differences in the sex chromosomes, which are X and Y. There are some NIPT tests that have expanded panels that are available as well, which can also look at smaller missing pieces of DNA on different chromosomes or other more rare chromosome abnormalities.
Okay, so let's talk a little bit about what the results are telling us and then how we're going to use that information.
Results of your NIPT can come back showing that the expected number of chromosomes is found for your pregnancy, meaning that you can be reassured that your developing baby doesn't have one of these chromosome conditions. On the other hand, results can come back showing that an abnormal number of chromosomes was detected, meaning that you are at a higher chance for having one of these conditions in your pregnancy. Now, any screening test can have a positive test result, and that condition is actually not present in the pregnancy, and this is called a false positive. The good news with NIPT is that the chance of having a false positive is much lower than with any other prenatal screening option. There is also a chance that you could have a normal, reassuring NIPT test result, but your pregnancy does actually still have one of these conditions tested for. This is called a false negative. There are many different types of NIPT that are available, so it's important that you talk to your doctor about which specific NIPT you've had, how the test is performed, what conditions it tests for, and what the chances are that you'll have what's known as a test failure, meaning that no test result is able to be reported to you. NIPT is superior to any of the other screening options as far as the accuracy and the detection rate of these conditions. So if you have a normal, reassuring NIPT result, you can feel very good about that.
I still think it's amazing that women have so many options nowadays because it seems like there's so much to consider when you're a mom-to-be. What would you tell women who are considering NIPT?
Well, I think the decision to screen or test for chromosome conditions during pregnancy is a very personal decision. And I would encourage a woman who's considering this to think about what this information would provide. Would it allow for her and her family to prepare for the future? A person could consider speaking with their healthcare provider or a genetic counselor about what a positive test result could mean for their developing baby. Lastly, most women will get a negative test result, which gives them reassurance about the health of their developing baby.
Thank you so much for being here, Patty. You know, I think what it comes down to is with today's new technologies, new moms have a lot of options to get some early insight into their baby's health, and that's a great thing. For more information on the non-invasive prenatal testing option discussed today, visit illumina.com, and you can always go to our website, accesshealth.tv. We'll see you next time.
Today we've been discussing patients having more choices when considering treatment options. One such option is providing patients with the same surgical techniques but with less trauma and almost invisible scars. Access Health caught up with Dr. Stephen McCarris, who is a nationally known leader in the practice of minimally invasive gynecological surgery.
A minimally invasive surgery is something we offer almost all our patients, and it's a surgical technique that is less invasive, meaning it requires small incisions, usually about the size of a dime, one through the belly button or umbilicus, where a camera is placed so you can look inside the abdominal pelvic cavity, and then usually on the lower left and lower right side of the abdominal wall.
The benefits of minimally invasive surgery are multifaceted compared to open surgery, such as shorter hospital stays, as well as a reduction in costs. And what does this mean for patient outcomes?
Laparoscopic surgery lends itself to less post-surgical complications compared to when you do an open procedure. A large incision means a longer recovery, increased risk of infection or bleeding or scarring. If there's less injury, there's quicker healing. There's shorter hospital stays. There's getting the patient back to her life and her normal routine sooner.
I still go to the beach. I'm a beach bum. I love going to the beach with my daughter. I don't wear a bikini, but if I wanted to, I don't want a big scar. There's new technology now that can allow us to have a surgery and not have to have that big scar. It was a nice option to know that the surgery could still be done just as well, just as effective, with very little incisions.
I noticed that my periods were extremely heavy, very irregular, painful, and really interfered with my daily activities and my life and all of the activities that I needed to do at the time. There was absolutely no way I could be down for 6 weeks. With my kids at that time, they were, 4, 9, and 11. Dr. McCarris at that point suggested there was a less invasive technique, a minimally invasive surgery.
Developments in instruments, imaging, and surgical techniques have improved the outcomes and feasibility of laparoscopic surgical procedures. Percutaneous laparoscopy is a new category of minimally invasive surgery that requires smaller instruments than traditional laparoscopy and leaves nearly unnoticeable scars. How are they doing this? We enlisted the help of Dr. James Dana Condrup, a minimally invasive gynecology specialist, to explain.
From the point of view as a surgeon, what we're doing is we're doing the same techniques, we're doing the same type of surgery that's been proven over time. We're just using different instruments to do that surgery. So now we're using instruments that are much smaller. They're versatile, they're very easy to use, but the nice thing about the percutaneous instruments, the mini-lap and the percuvance, they're very versatile. Even in difficult surgeries that are very challenging to the surgeon, they're still applicable in that situation also. The mini-lap can be inserted directly through the abdominal wall, right through the skin. When I use the percuvance system, all I have to do is take a small needle, pass the needle through, and then pass the percuvance instrument through the abdominal wall.
Companies such as Teleflex are dedicated to improving the patient experience by making MIS even less invasive by combining access and instrumentation, making the incision even smaller.
For a lot of women, minimally invasive surgery which you have less invasive techniques, is very important to them because they're very concerned about their scars. When it heals, it looks just like a little mole or a freckle, really, really tiny. So the benefit is to the patient from seeing tiny little incisions or not seeing the incision at all. Also, you have less trauma to the abdominal wall when you use these very small percutaneous incisions and very small percutaneous instruments.
When surgery is needed, women need to be educated about what are the associated complications to their particular surgery. That information is available. We encourage women to get involved and be part of the strategy and what they want out of these types of operations, and to actually vet their surgeon that's going to do the best job. That's really what the message is. Find the surgeon that you know is an experienced expert surgeon in the technique that you need.
The tools and techniques for minimally invasive surgery are constantly evolving, and one priority is always in the forefront: what's best for the patient. I'd like to thank our patients and doctors for all of the information on minimally invasive surgery. For more information on the Percuvance, percutaneous surgical system, visit teleflex.com. And of course, you can find all of these resources by logging on to our website at accesshealth.tv. Don't forget to follow us on Facebook and Twitter.